Want to start out by just, again, thanking you guys all for your outstanding coverage. It's been informative, critical, and uplifting. You can't really put a value on when our team sees Nicole's story last night, when we get to see Sarah Morris on our television screen and members of the Blackburn manufacturing team. It certainly made my day and that of so many of our employees. And you're covering so much ground. Shameless plug for our local paper here. From the article on the SBA loans that Union Bank's number 2 in the country for processing, the cute twins birthday party, the choices we make was very interesting. Impact on college sports. What I think is really interesting about this is it's mostly reinforcing the explicit or implicit impact that social distancing is having on our world. We know how hard this is for all of us in society, and you guys are giving us a great look of it. I really, really do respect the article on hospital preparedness that was on page 1 below the fold. I know I can only speak for the Bryan references, but it was an outstanding representation of the many kind of moving and connecting parts that have been reported over the lifespan of these 18 briefings. And I hope all of the readers made it to the end of that article, where it's talking about how our community efforts have slowed this down, but we really can't let our guard down. So shameless plug, I invite all of you to join me in being a subscriber. The COVID coverage has been free to the public, but our local media needs our support more than anything else, and they've been proven to be so helpful and so different than the infotainment industry that so many are also tuning into. So please join me in supporting our local media. We use a company called Stericycle to remove all of our medical hazardous waste. And our COVID PPE waste is essentially treated no differently than any isolation situations we would have. And we have actually not seen an increase in the pickup of our designated dumpsters. And the biggest reason is with the decrease of surgical procedures and the of elective cases, it's really brought that down. So, and they've kind of balanced each other out. So I hope that gives you what you need, Mike. One quick announcement: our drive-through clinic will be closed on Easter. However, we're getting more and more efficient at that, so we're increasing the volume in the same set hours by 20 on both Friday, Saturday, and Monday to compensate for that day off of Easter. To some stats before we get to John. Screening visit questionnaire, step 1 of our kind of front line on this. 8,632 have completed the COVID-19 screening questionnaire, resulting in 2,380 easy visits. And of those, 1,099 have been using the COVID-19 promo code. Our midnight census was 376, a little bit of a tick up for a variety of reasons. I'm going to start the kind of test results a little bit differently because we're moving into a phase, and I think you guys all have seen how drive-through, urgent care, hospital, they all start or all roll together. So I'm going to start with the total rather than going down through a run-through. In total, Bryan has tested 1,148. We now have 48 positive test results, 950 are negative, and 150 are pending. John will speak to who's in house and who's at home and some of the ICU, PCU vent statistics. If any of you want specific stats on the drive-through urgent care or hospital specific, let us know. Otherwise, we'll just kind of report the rolling total. The percentages are staying the same. Drive-through is obviously the heaviest testing location, followed by the hospital, and then our walk-in respiratory third, and that's been pretty consistent. So again, 1,148 tested, 48 positive, 950 negative, and 150 pending. With that, I'll turn it over to John.
Thanks, Bob. I'm John Woodrich, CEO of Bryan Medical Center, and I wanted to give a little bit of a breakdown in relationship to COVID patients in-house. We currently have 5 in-house that have tested positive. Those are all Lancaster County residents. Of the pending, we have a total of 17 individuals in-house. 15 of those are from Lancaster County and 2 are from outside of the county. So if you total our number of positives and pending, we have 22 individuals in-house. 7 of the people are in the ICU, 4 are in our progressive care unit, 11 is in our general care units, and we still have 2 of the positive individuals that are on a ventilator. I think you guys had asked before about what is our capacity specifically to ICU. We have the capability of converting rooms up to a number as high as 200 that could provide critical care and ventilator care. Currently, our census in the ICU, this is counting our COVID patients and just our regular business, is 32. So you can tell we have quite the capacity. We've been able to increase our number of ventilators here, that now we have the capability of having 161 ventilators here at the Bryan campus. We also have 4 neonate ventilators as well for our little ones. With that, we would take any questions that you may have via chat. It's basically our BiPAP machines that we are able to convert into ventilators, and that's added another 25 plus to our number of ventilators at Bryan Medical Center. We have not been tracking those just due to the fact, as I mentioned yesterday, as we do positives, realize that also we are retesting some patients. So we're giving you the number of positive test results. Currently, that could be, as we said, 48. It's right now, we believe it's about 44 patients. The last that I knew of, we only had 1 that was outside of our county, but I have not looked at those numbers recently.